Good morning, ma'am, and good morning, classmate. I'm Sunshine Astera, the reporter for the day, for session 16 entitled Disorders Associated with Immune System. So, hypersensitivity. Ang hypersensitivity refers to an antigenic response beyond that which considered normal. No, kung saan yung hypersensitivity daw ay normal sa isang tao. Allergens. Ang allergens ay isang substances na kung saan nagkukos siya ng hypersensitivity reaction sa isang tao. Immunopathology. Ang immunopathology, sila yung nag-aaral ng hypersensitivity reaction sa isang tao. Hygiene hypothesis suggests that limiting childhood exposure to bacteria and parasites may lower immune tolerance and limit the body's ability to cope with harmless antigens, katulad na nga lang ng food or yung pollen. So, merong dalawa tayong uri ng hypersensitivity. Ito nga yung immediate type hypersensitivity and delayed type hypersensitivity. So, let's start to immediate type hypersensitivity, na kung saan occurs from few minutes to 24 hours after contact with a particular antigen. And yung delayed type hypersensitivity naman is usually takes more than 24 hours to manifest itself, na kung saan tinatawag din siyang type 4 hypersensitivity reaction or cell-mediated reactions. So, meron tayong apat na uri ng hypersensitive reactions. So, ito nga yung type 1 reactions, type 2 reactions, type reactions, and also the type 4 reactions. So, let's start to discuss the type 1 reactions, or mas tinatawag siya as anaphylactic reactions or allergic reactions, na kung saan sa type 1 reactions nga kabilang yung mga sintomas ng lagnat, asthma, yung hives or yung pagpapantal, gastrointestinal symptoms, na kung saan nagre-result siya mula sa food allergies, allergic reaction to insect sting, and dun sa drugs. Na kung saan yung type 1 reactions naman is occurs 2 to 30 minutes after a sensitized person is exposed to an antigen. Anaphylaxis. So, ang anaphylaxis naman is inclusive term siya for the reaction na kung saan nagkukos siya kapag yung antigen is kinumbine sa IgE antibodies. Mast cells. Yung mast cells naman is especially traveling in the Marcus Allen and connected siya sa tissue ng skin and respiratory tract and dun sa surrounding blood vessels. Next is yung basophils. Yung basophils naman is in the bloodstream, na kung saan recruited siya doon sa site ng infection. Mast cells and basophils contain granules of histamine and other chemical mediator, na kung saan yung mast cells nga daw and yung basophil siya is naglalaman siya ng granules of histamine at ng ibang chemical mediators. Release histamine, increase blood flow, and the permeability of blood capillaries, resulting edema, swelling, and erythema or redness. So, yung pag-release daw ng histamine is nagtataas ng blood flow, and yung permeability ng blood capillaries ay nagdiresulta ng edema or yung swelling and erythema or nagiging redness. Mast cell sensitization, na kung saan yung mast cell sensitization, first exposure to antigen causes plasma cell to produce specific IgE antibodies which attach to the surface of tissue, muscles, and blood basophils. Next is yung binding allergens. Yung binding of allergens naman is receptor band LGE molecules are cross-linked by antigens or allergen. Next natin is yung mast cell degranulation. Ito naman is synthesized mast cells are stimulated to release granules na kung saan nagko-contain siya ng histamine, leukotrienes, prostaglandins, at ng ibang potent chemical mediator. So, meron tayong dalawang uri ng anaphylaxis, yung systemic and localized. So, yung systemic anaphylaxis is tinatawag siyang anaphylactic shock, na kung saan a life-threatening LGE-mediated hypersensitivity characterized by severe hypotension, vasodilation drop in BP, bronchoconstriction, and massive release of mast cells and basophils mediators, respiratory distress, flush or skin rash, tingling sensation, and nausea. And yung example nga ng systemic anaphylaxis natin is yung penicillin allergy. So, yung localized anaphylaxis naman is usually immediate, temporary, and less severe than systemic anaphylaxis. So, sinasabi lang na yung systemic anaphylaxis is severe siya kumpara sa localized anaphylaxis kasi less severe lang siya. Localized anaphylaxis is associated with antigens that ate ingested foods or inhaled pollen. Next is yung atopic reaction. Ang atopic reactions is a non-life-threatening LGE-mediated hypersensitivity characterized by a localized inflammatory process. Atypical are itchy and teary eyes, congested nasal passages, coughing, and sneezing. Antihistamine drugs. Ang antihistamine drugs, which is complete for histamine receptor sites, are often used to treat these symptoms. So, yung antihistamine drugs, siya yung ginagamit na pang-treat dun sa mga symptoms na sinabi ko kanina. And yung mga example nga niya is asthma and hay fever. So, paano ba mapiprevent yung anaphylactic reaction? So, meron tayong isa na pamamaraan paano ba ma-prevent yung anaphylactic reaction. So, ito nga yung desensitization. So, yung desensitization is tinatawag siya as subcutaneous allergen specific immunotherapy, na kung saan itong procedure na ito is usually consists of a series of gradually increasing dosages of the antigen carefully injected beneath the skin. Then yung objective niya is to cause the production of LGG rather than LGE antibodies. And yung LGG is nag-a-act siya as blocking antibodies. Type 2 reactions, or mas tinatawag siya as cytotoxic reaction, occurs naman siya 5 to 8 hours. Antigen causes formation of LGM and LGG antibodies that bind to target cell. So, yung antigen niya is formation o cause formation ng LGM and LGG antibodies na kung saan nagbibind siya sa kanyang target cell. O kung saan kapag ito ay nag-combine with reaction of complement, destroy target cells. Ang example nga niya is yung transfusion reaction, Rh incompatibility, Myasthenia gravis. A typical type 2 hypersensitivity reaction may follow this sequence. So, meron tayong 4 na steps. So, first steps is a particular drug binds to the surface of the body cell. Step 2. Anti-drug antibodies then bind of the drug. Step 3. This initiates complement activation of the cell surface. And yung step 4 niya is, the complement cascade leads to lysis of the body cell. So, ABO blood group system. So, itong ang blood group na ito is merong 4 na principal type. Yung A, type B, type AB, and type O, na kung saan na-discover ito ni Karl Landsteiner. The ABO blood group system. So, blood group A, B, AB, and O. So, sa type A, yung erythrocyte antigen niya is positive A. Yung plasma antibodies niya is anti-B. And yung cell that can be received niya is type A and type O. So, sa type B naman, ang erythrocyte antigen niya is type B. Ang plasma antibodies niya is anti-A. And yung cell that can be received niya is type B and type O. Next is type AB, na kung saan ang erythrocyte antigen niya is A and B. And yung plasma antibodies niya is neither anti-A nor anti-B antibodies. And yung cell that can be received niya is type A, type B, type AB, and type O. And lastly is yung type O. Yung erythrocyte antigens naman niya is neither A and B. And yung plasma antibodies naman niya is anti-A and anti-B. And yung cell that can be received naman ng type O is also type O. Anti-A and anti-B antibodies are not present in the newborn. They appear in the first years of life. So, yung anti-A and anti-B antibodies ay hindi siya present sa bagong panganak. So, nag-a-appears lang tong anti-A and anti-B antibodies na ito kapag 1-year-old na yung isang bata. Type O person express only H antigen, and type A individuals convert the H antigen to the A antigen. Antigen-antibody reaction causes agglutination and activates complement, which in turn causes lysis of the donors. So, blood typing. Ang blood typing is agglutination test used in the blood bank to learn person blood type, which is determined by the types of antigens present in the surface of her or his or disease. So, meron tayong 3 reagent na ginagamit para sa ABO and FRH typing. So, una na dito yung anti-A, anti-serum, na kung saan a serum containing antibodies against A antigen. And yung anti-B, anti-serum, a serum containing antibodies against B antigen. Yung anti-RH, anti-serum, a serum containing antibodies against RH antigen. Blood typing. So, type A positive. Ang A antigen niya is present, ang B antigen niya is absent, and yung RH antigen naman niya is also present. Type A negative. Ang A antigen niya is present, ang B antigen niya is absent, and RH antigen is also absent. Ang type B naman natin is ang A antigen niya is absent, B antigen niya is present, and yung RH antigen niya is also present. Next is type B negative. Ang A antigen niya is absent, B antigen is present, Rh antigen is absent. Type AB positive. Ang A antigen niya is present, B antigen niya is present, and Rh antigen niya is also present. Type AB negative. Ang A antigen niya is present, B antigen niya is present, and yung Rh antigen niya is absent. Sa type O positive naman is yung A antigen niya is absent, B antigen niya is also absent, and Rh antigen niya is present. Type O negative. Ang A antigen niya is absent, ang B antigen niya is absent, and Rh antigen niya also absent. Rh blood group system o yung Rh means rhesus monkey. The roughly 85% of population whose cells possess this antigen are called Rh positive. Thus lacking this antigen, about 15% are Rh negative. So, ang sinasabi dito na kapag yung roughly 85% of population is possessed ng antigen na ito is tinatawag siyang Rh positive. Pero kapag naman yung antigens is lacking about 15% is siya naman ay negative or Rh negative. Blood transfusion and Rh incompatibility. If blood from an Rh positive donor is given to an Rh negative recipient, the donor's RPCs stimulate the production of anti-Rh antibodies in the recipient. If the recipient then receives Rh positive red blood cells in the subsequent transfusion, a rapid serious hemolytic reaction will develop. Hemolytic disease of the newborn. First described as erythroblastosis fatalis. Production of large numbers of immature RBCs ay tinatawag na erythroblast. The newborn develop jaundice and severe anemia. Then yung prevention na ay GORAM 4 or ml given. Na kung saan 28 weeks of pregnancy and soon after delivery. Drug-induced cytotoxic reactions. Thrombocytopenic purpura. Kung saan yung thrombocytopenic purpura, molecules of a drug such as cocaine accumulate on the surface of a platelet and stimulate an immune response and destroys the platelet. Loss of platelets result in hemorrhage that appear on the skin as purple spot or purpura, which means purple. Hemolytic anemia or blueberry muffin skin mottling. Agranulocytosis, destruction of granulocytic white cells which affects the body phagocytic defenses. Next is yung type 4 reaction or mas tinatawag siyang immune complex reaction. Occur siya 3 to 8 hours. Antibodies and antigen from complexes that cause damaging inflammation. Ang example nga ng type 3 reaction is yung Artus reactions, serum sickness, SLE, rheumatoid arthritis. Type 4 reactions or mas kilala siya as delayed cells-mediated reaction. Occur siya 24 to 48 hours. They occur in the tuberculin and fungal skin test, contact dermatitis, and transplantation rejection. Antigens activate cytotoxic T lymphocytes that kills target. So, ang example nga niya is rejection of transplanted tissues, contact dermatitis such as poison ivy, cosmetics and metal jewelry or nickel, certain chronic disease such as tuberculosis. Cessation is the cause of delayed cell-mediated reaction. Example niya nga yung TB skin test o Montauk skin test, na kung saan itong test na ito is piniperform by injecting 0.1 ml of tuberculin or PPD intradermally and observing the result 48 to 72 hours later. If the person has been exposed to mycobacteria in the past, redness and swelling will occur at the injection site. This constitutes a positive TB skin test result. The diameter of induration, the palpable, raised, hardened area, not the area of redness, is measured, and the results are interpreted using standardized criteria. The following events occur to produce the positive reaction. So, meron tayong 5 step para malaman yung positive reactions. Within 2 to 3 hours after injection of the PPD, there is an influx of polymorphonuclear cells or polymorphonuclear cells or PMNs into the site. Step 2. This is followed by an influx of lymphocytes and macrophages while the PMNs disperse. Step 3. Within 12 to 18 hours, the area becomes red or erythematous and swollen edematous. Step 4. The erythema or redness and edema or swelling reach maximum intensity between 24 and 48 hours. Step 5. With time, as the swelling and redness disappear, the lymphocyte and macrophages disappears. Autoimmune disease. Ang autoimmune disease nagre-result siya when a person's immune system no longer recognizes certain body tissues as such and attempts to destroy those tissues as if they were non-self or foreign. Occurs when there is a loss of self-tolerance. The immune system's ability to discriminate self from non-self. So, ang example nga niya is yung SLE-RA Myasthenia gravis. So, meron tayong 4 na mechanism ng autoimmunity. Yung molecular mimicry, alteration of normal proteins, superantigens, and release of antigens from previously privileged site from trauma. Type 1 autoimmunity. Na kung saan yung type 1 autoimmunity involves antibodies that attract cells. Example nga niya is yung hepatitis C. Type 2 or cytotoxic autoimmune reaction. Siya naman ay mediated by antibodies specific for cell surface components or the extracellular matrix. Example nga ng type 2 is multiple sclerosis. Type 3 or immune complex autoimmune reaction is mediated naman siya by the formation of immune complexes. Example niya is SLE-RA Gravis disease and Myasthenia gravis. Type 4 or cell-mediated autoimmune reaction. Mediated naman siya by effector T cells. Example niya is yung Hashimoto's disease, insulin-dependent diabetes mellitus, and psoriatic arthritis. Immunodeficiencies. So, meron tayong 2 types ng immunodeficiencies, yung congenital and acquired immunodeficiencies. So, start muna tayo sa congenital immunodeficiencies. Ang congenital immunodeficiencies is tinatawag siya as primary immunodeficiencies. And yung example niya ay DiGeorge syndrome. And yung acquired immunodeficiencies naman is tinatawag siya as secondary immunodeficiencies. And yung example naman niya is yung Hodgkin's lymphoma and AIDS. Acquired immunodeficiency syndrome or AIDS na tinatawag. Related to lentivirus, simian immunodeficiencies virus or SIV. HIV is thought to have originated in Africa. Yung HIV daw ay nagmula sa Africa na dala ng mga unggoy, mongoose, and chimpanzee na kung saan dinala nila sa iba't ibang bansa gamit yung mga modern transportation and unsafe sexual practices. HIV infection. The structure of HIV. So, ito yung mga structure ng HIV. Yung retrovirus, 2 identical plus standard RNA molecules, reverse transcriptase and invertase, envelope, and Go20 spike. So, infectiveness and pathogenicity of HIV. HIV spike attached to CD4 and co-receptors on host cells. The CD4 receptor is found on the T helper cells, macrophages, and dendritic cells. Viral RNA is transcribed to DNA by reverse transcriptase. The viral DNA becomes integrated into the host chromosome to direct synthesis of the new viruses or to remain latent as a provirus. HIV evades the immune system in latency and vacuoles by using cell-to-cell fusion and by antigenic change. Subtypes of HIV. So, meron tayong dalawang subtypes ng HIV. Yung HIV-1 and HIV-2. So, let's start to HIV-1. Accounts for 99% of cases worldwide. So, yung HIV, so meron ng cases sa buong mundo na nagkakaroon siya ng 99%. So, yung HIV-1 is meron siyang dalawang subtypes, yung subtype B and subtype C. Subtype A, siya is dominant HIV, na kung saan found siya or makikita siya sa Europe, Australia, Japan, and sa Amerika. Then, yung subtype C naman is half lang sa mga tao yung nadadiagnose ng HIV-1. Next is yung HIV-2. Is endemic in West Africa. So, yung HIV-2 naman is endemic siya sa West Africa pero ini-spread siya sa buong mundo pero limited lang siya. Longer asymptomatic period with lower vital load and mortality rate. Stages of HIV infection. So, meron tayong stages ng HIV infection. So, phase 1 or asymptomatic phase. Billions of CD4 positive T cells may be infected within a few weeks, lowering their numbers, immune responses, and fewer uninfected. Cause lymphadenopathy or swollen lymph nodes. Phase 2 or symptomatic. Numbers of CD4 positive T cells decline steadily. Indicators: yeast infection in the mouth, throat, and vagina. Fewer persistent diarrhea. Oral leukoplakia, shingles may appear due to the declining immunity. Next is yung phase 3, AIDS indicator conditions. CD4 positive T cells counts fall below 200 cells, and susceptibility to opportunistic infections is high. Indicators: Candida albicans infection of bronchi, trachea, lungs, CMV, eyes infections, tuberculosis, pneumonia, toxoplasmosis of the brain, and Kaposi's sarcoma. During naman daw sa phases 1 and phase 2 ng infection, yung patient ay pinaklasify as HIV positive. During naman sa phases 3, yung patient is kinaklasify siya na mayroong AIDS. Purpose: primarily to furnish treatment guidelines on when to administer certain drugs. Diagnostic method: HIV antibodies are detected by ELISA and Western blotting. So, yung HIV antibodies is na-detect gamit yung ELISA and Western blotting. Plasma vital blood test is na-detect siya using vital nucleic acid and are used to quantify HIV blood. So, meron ditong 7 na HIV transmission. So, itong 7 na ito yung pamamaraan. Bakit nga ba nagtatransmit or kumakalat yung HIV? Una na dito yung sexual contact, breast milk, transplacental infection of fetus, blood-contaminated needles, organ transplant, artificial insemination, and blood transfusion. May high-risk form of sexual contact for HIV infection is anal receptive intercourse. Prevention and treatment. So, paano nga ba natin magagamot or maiiwasan yung pagkalat ng HIV? So, transmission can be reduced by biomedical, behavioral, and structural intervention. So, yung pagkalat nito ay mababawasan gamit lamang yung biomedical, behavioral, and structural intervention. Current chemotherapeutic agent target cells entry and the virus enzyme, including reverse transcriptase, integrase, and protease. Vaccine develop is difficult because there are different antigen clades and the virus remains inside the host cells. And dito na po nagtatapos ang aking report.